Psychosis is a condition of the mind that results in difficulties determining what is real and what is not real. Symptoms may include delusions and hallucinations. Psychosis has many different causes. The neurotransmitter dopamine is believed to play a role. Acute psychosis is considered primary if it results from a psychiatric condition and secondary if it is caused by a medical condition. The diagnosis of a mental health condition requires excluding other potential causes. Testing may be done to check for central nervous system diseases, toxins, or other health problems as a cause. Treatment may include antipsychotic medication, counseling, and social support. Outcomes depend on the underlying cause. A hallucination is defined as sensory perception in the absence of external stimuli. Hallucinations are different from illusions and perceptual distortions, which are the misperception of external stimuli. Hallucinations may occur in any of the senses and take on almost any form. They may consist of simple sensations or more detailed experiences. Hallucinations are generally characterized as being vivid and uncontrollable. Psychosis is rare in adolescence. Extreme stress or traumatic life events have been linked with an elevated risk in developing psychotic symptoms. Childhood trauma has specifically been shown to be a predictor of adolescent and adult psychosis. People experiencing a psychotic episode in the context of depression may experience persecutory or self-blaming delusions or hallucinations, while people experiencing a psychotic episode in the context of mania may form grandiose delusions. Stress is known to contribute to and trigger psychotic states. A history of psychologically traumatic events, and the recent experience of a stressful event, can both contribute to the development of psychosis. Short-lived psychosis triggered by stress is known as brief reactive psychosis, and patients may spontaneously recover normal functioning within 2 weeks. In some rare cases, individuals may remain in a state of full-blown psychosis for many years. Drugs commonly alleged to induce psychotic symptoms include alcohol, cannabis, cocaine, amphetamines, and psychedelic. Caffeine may worsen symptoms in those with schizophrenia and cause psychosis at very high doses in people without the condition. Cannabis and other illicit recreational drugs are often associated with psychosis in adolescents, and cannabis use before 15 years old may increase the risk of psychosis later in life as an adult. Consult with the doctor is highly recommended medication for this illness. Only a trained medical professional can diagnose this disorder, and diagnosis is key to getting proper treatment. There is no shame in taking medication for a mental illness. Do whatever works for you. Remember, even if you have mental illness, you are not your mental illness. That illness is just part of you.